I was asked to talk about my research, and I think that we actually have experts like Erica, and I know there are other families in the room, so I'm sort of reporting, I guess you could take it as an indirect family reporting about a group of families who participate in my studies, but if it becomes too repetitious, then I can just speed through it and we can talk about other kinds of transitions as well. So the study that I'm going to talk about was funded by the National Institute of Child Health and Human Development and the National Institute of Nursing Research, and these are the members of my research team. So I became interested in children with special health care needs because I'm a nurse, and I spent a long time, I've had kind of a two-part career. For 16 years, I worked taking care of kids and families. And so when I went back to get my PhD, I wanted to do my dissertation with Mexican-American families because I was practicing in San Diego and I could find virtually nothing in the literature about the experience of Mexican-American families. And so I did do that. So then, I've continued to do my studies with families whose kids have special health care needs. And I became interested in the transition to adulthood because I had started to do research with younger kids, and a study that I did with parents of elementary school kids, they told me how concerned they were about what was going to happen when both they themselves were getting older and their children were getting older and bigger and harder to take care of when they had complex chronic conditions and needed a lot of personal care or a lot of management that the kids couldn't do 100% on their own. So for this particular study, we focused on teens and young adults, age 14 to 26. And I'm particularly interested in that population of young people who will continue to need assistance into adulthood. And so we defined complex chronic conditions for this study as having a chronic health condition that requires ongoing monitoring or treatment and a developmental disability. And so all of the youth either were or had been in special education services in schools. So these are some of the kids who participated in the study, and about half of the kids were not verbal, and so we wanted to find ways for them to have a role in the study, and one of the ways we did it was that we asked the kids if they'd like to give us a picture, or we could take their picture. And so we ended up with pictures at Special Olympics and graduation and prom, and then a lot of photos with my iPhone. So our purpose was to explore planning processes for the family, especially their interactions with schools and healthcare providers who are charged, for the most part, with planning for the transition to adulthood. And I'm interested in looking at the impact of planning on roles and responsibilities for family members. So just as background, probably I don't need to tell a room full of MCH professionals these figures, since they come from the National Survey of Children with Special Health Care Needs. But about 23% of children who do have special health care needs also have developmental, behavioral, or mental health issues. And only about 30% of them are receiving formalized services for the transition to adulthood. Oh, did it fall out?
Fall out. It fell out.
How did that happen?
Put it there like that.
Okay. Oh, I think I have two now. Okay. So So as you know, and I think Erica spoke so eloquently, there is a huge impact upon families for providing care for children with special health care needs, and about 49% of parents cut back or stop work. 31% paid up to $1,000 out of pocket, and 28% paid over $1,000 out of pocket. And then 25% spent over 11 hours a week on care coordination as a family member. So it's a huge impact. And so the good news, conventional wisdom says that 90% of children with special health care needs live into adulthood. It's very hard to pin down a specific epidemiological study that actually documents that, but that's the conventional wisdom. And I think a very important point that much of the public probably doesn't acknowledge, and that our services should be aimed to support, is that children with special health care needs have the same civil rights as all Americans, and that includes the right to pursue opportunities for a full and dignified life. And there is a growing recognition to support these opportunities. So planning for the transition to adulthood is mandated in a couple of different realms. One is through the Individuals with Education Disabilities Act, Education Act idea, and it's mandated that children have goals in their IEP by age 14 and specific plans to meet those goals by age 16. I found that was not always the case. So schools tend to focus on a variety of programs that can help kids be ready for what happens after high school. Children with special health care needs are allowed to stay in school-based programs until age 22. And school districts arrange that in a variety of ways. Some of them will put the kids into separately funded transition programs. San Francisco does that. Other school districts will keep the kids in classrooms where older kids are participating. So the one thing about school districts that I can say is that they are very locally controlled, meaning that they have to meet state and federal mandates, but how they do that and how much money they have to do that is hugely variable. So you will see a huge range of services. I started my faculty career after I did my postdoc here in San Francisco. I went off to New Mexico for a few years. And the school system and the statewide supports for children with special health care needs are organized very differently than they are when I came back to California. So especially at the schools, it varies a lot even by county to county within the Bay Area. So at the school district, they tend to focus a lot on readiness for employment or future education, and barring attending college or going into paid employment where you would be competitive with the market, then the schools will sometimes get involved in programs that will facilitate community participation, social skills, and day-to-day living skills. But that varies a lot by county and by school district. But some school districts also provide assistance for families in seeking long-term housing, and most of them provide assistance with seeking activities programs after high school for kids who will not pursue further education or direct employment. The other place that planning for the transition to adulthood is mandated, although there's no funding for this mandate, is through professional medical organizations. So the American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Physicians, the Society of Internal Medicine Division, all have cooperated to plan together the kinds of programs, checklists, planning processes that they think that children with special health care needs need in order to make a smooth transition from a pediatric-focused healthcare system to an adult-focused system. And there are some wonderful websites and resources. Do you all know about Got Transition? Yeah, well, that's a, I think it's even GOT Transition .org, I believe it is. Or you can Google Got Transition, and there's a main website that has a lot of resources, both for professionals and for families and youth. And so that was an outgrowth of this cooperation between these three professional organizations. But getting it down to the practice level where children and youth actually receive their care, that's another whole thing. So here are some of what we define in general as the needs that have to happen for a healthcare transition to take place. You have to find an adult-focused healthcare team. That includes primary care and then whatever kinds of specialty services any given person needs. And you have to learn chronic care self-management skills, right? And so that's going to vary hugely depending on how independent young people can become. And so for some young people, the goal is to completely take over their own decision making. And for many, that's entirely possible. And so in that case, the goal of the healthcare system should be to help them to understand their disease process, the medications they take, their history, and then to learn how to navigate complicated healthcare systems so that they can go on to manage their own care. For young people who will continue to need assistance, if it's physical assistance, they may be perfectly capable of managing all aspects of their care, including their caregivers. So managing aids and durable medical equipment companies and all of the assistance that they need to be as independent as possible. But for many young people, including those who were participating in this study, some of them on the higher spectrum of needs may not ever be able to be 100% independent in managing their own care, so they will always need assistance. And so in that case, what the goal has to be is to optimize independence and ability to navigate systems. So that includes your physical and mental health needs, chronic condition needs, medications, assistance devices, relationships with providers, which change a lot from family-centered pediatric care. Being family-centered is a value of pediatric medicine, nursing, and services. The family is an integral part of services that are provided to children. But what happens when you reach adult-focused healthcare systems? Where is the focus? On the individual. right? So that has real implications in terms of privacy, sharing of information, sharing of responsibility, partnering, etc. And so those are huge issues that families have to navigate and anticipate. And looking for an adult-focused provider and system that is willing to continue family involvement is although there are legal limitations to information sharing and so forth because of HIPAA. And so families have to anticipate that. Pediatricians and care providers for young people need to help families to figure out what they need to do to be able to facilitate whatever level of involvement is agreed upon for any individual young person and their family care providers. Coordination of your own care to the extent possible, and then healthy living, right? Prevention, 5 more minutes, of secondary conditions. Okay, so this was a descriptive interpretive field study. It's ethnography in the symbolic interaction, sociological tradition, so technicality. So what we did was interviews with parents and youth when they were verbal, teachers, healthcare providers. We did observations at home visits, and we accompanied care providers to the IEP and youth. We reviewed materials that are relevant. So we interviewed parents, 61, 55 we interviewed in a second time as well, 38 youth, 36 teachers. We attended 41 IEPs, and we interviewed 26 primary care providers, some pediatricians and some adult providers. And this is what we did for analysis. So the youth, we divided them into 3 age groups, and most were in high school or a transition program. We had a sample that was about 45% people of color, but unfortunately had too few of any one particular ethnic or racial group to be able to draw conclusions. So what we were able to see is what people from diverse backgrounds have in common. And so my next project, I want to study Spanish-speaking families, go back to my roots, because I think that there's still very little information, and particularly almost nothing for people who don't speak English. So the family composition, the parents, 77 parents participated in the study. So a 22-year-old said, being on my own, enjoying freedom. Sometimes it's hard, sometimes it's not, sometimes it's complicated, but I like being on my own. She was living in an assisted care facility. A mother, she wanted her daughter to be happy and healthy and not to have to give up her current lifestyle. So parents' priorities, and there's an article in your packet of an article on priorities that we wrote. So protecting youth's health, assuring their safety and security. Safety was a huge theme. Enrollment in safe, supportive, meaningful, and stimulating educational activity programs after high school, and then having a meaningful social life. These are the components of health, and I know I'm running short on time, so I'm going to kind of skip ahead here. A pediatrician said, and I think it's very true, he wouldn't be surprised if a lot of medical transitions happen at older age groups, because parents and pediatricians recognize that adult practices are not family-centered, so they tend to cling to each other. So I think what our obligation as healthcare providers is to help families to find and to be able to state their needs when they get to adult practices, and to find practices that will be receptive. Safety and security was huge. Housing, legal protection, financial security, and protection from physical, sexual, financial, and emotional exploitation and abuse are all huge issues. Here was a mother, this is very poignant. She talks to strangers, so that's like why I want her to be with somebody. She talks to strangers, she hugs strangers. I'm not amused. So that type of behavior worries me because it's easy to take advantage of her. So housing was a big issue. Parents debated where kids should live. Were they doing their kids a favor to keep them at home? Or would they be better off in a group home where they would have more control over their own lives? And this is a very family-dependent, culture-driven, tradition-driven kind of idea. It's going to vary family to family. And that's part of why I want to focus in the next study on very family-oriented culture where we did see a trend towards families intending to keep their kids at home. Okay, having a really good post-high school activity for kids to go to was really important to families. Okay, then I'm going to go back one. And this 25-year-old said, I wanted to stand out from my job because they like me. I want everybody to know, yeah, I can do that work every day. And I'm showing slight improvement, but I'm not quite there yet. So being able to find a niche is incredibly important to both youth and their families. Here's a mom who said, what does she do during the day? Is it a vocational program or some kind of activity program? It's very important to me that she's going to be stimulated. The thought of her sitting on a couch all day is horrible. And so, it's not just a program. It's not just somewhere to go. It's the right kind of place, the right kind of quality that was important to the parents in this study. Okay, so the major, and I am getting towards the end, the major categories of impact, day-to-day responsibilities were relentless. I think Erica described that very well. Families found it difficult to plan for transition because they were so busy with what goes on every day. Parents were committed. This was probably my biggest takeaway from the study. Parents were absolutely committed to long-term involvement with their youth. And I'm sure that's partly because of the nature of who volunteers to be in this kind of a study. But every one of the families wanted to stay involved. But they were a little ambivalent about how the siblings should be involved. They wanted their siblings to go off and have lives of their own, but they hoped the siblings would come around and still want to be involved with their sibling as they got older. This was an overwhelmed mother. I mean, we just thinking about the future, I just can't go there. So this is an example of a couple saying that they wanted their child always to be in their life no matter what they did. And here's a mother who was typical of another group who said, I would like to change from being the primary care provider to maybe contributing to the upkeep and running of the group home, where I think that, a really good place for my daughter to live. So, there's no right answer or wrong answer, right? You have to do what's right for your family. This is the mother with the sibling ambivalence. I'm hoping they'll go off and live their own life, but they'll be watching out for him. Doesn't have to live with them, but we haven't really talked about it. This, I think, is a huge issue. I think families have trouble. So in my next study, I want to include siblings and also extended family members that are identified by the family as important. Grandparents, aunts, uncles, whoever might be involved with the youth getting older. So the good news is that as hard as it was for families, by the time the oldest age group came around, 88% had a plan for housing, 81% had made a healthcare transition, and 100% had figured out what to do after high school because high school was over. So, parents retained commitment and responsibility for youth well into adulthood. Transition is long-term and evolving. They don't get very much personalized help during transition, and health and education professionals have to be aware of the comprehensive needs of youth and family during transition. And I think one of the hardest things is that health and education don't speak to each other much, so we go back to that coordination issue. So there were limitations to the study, of course. Next steps, we did test a person-centered planning intervention with support for families in San Francisco, and that showed a lot of promise, and it's being implemented at the Special Healthcare Needs Clinic at UCSF. And then I'm writing a grant now to study, I think it's going to be more Latino families, particularly those who don't speak English. So if anybody has a population that they think would be appropriate for this study that they'd like to help me recruit, great. And I do want to include interviews with siblings and extended family members. And that's it. So thank you very much.
Yeah. They can't wrap it around. So what I've learned,
Right.
culturally, and being part of that culture is like, how do I say this in layman terms without shutting them down automatically?
Absolutely. That is so important because you can't translate literally, right? You have to translate for the meaning. So, yeah, I mean, we're thinking about those issues. I think that's a really important point.
I was just curious, I know this wasn't a huge N, but did you see differences in terms of youth who had intellectual disabilities and those who did not?
Yeah, I mean, I think that there are differences in terms of what the end point is. When there are intellectual disabilities that will impede youth from reaching full independence, then the family has to be focused on what kinds of assistance are best to help our young person to be able to live the kind of life that they want to live in adulthood. When they have physical disabilities, it's usually more about how do we teach people to be independent in managing their health and education and future plans. And that's often not a full option for young people with intellectual disabilities. So there's a wide spectrum though, and sometimes people can be good at one thing along that spectrum and need assistance with other things. So it's very individualized, which makes it hard for systems to cope with because systems like standardization.
Lori? Thanks. Just from a systems perspective, what are the couple of takeaways from your study that you think policymakers should know?
I think that policymakers should understand that transition is multifaceted and that families need help in multiple realms, and that we have another study that we just submitted the article for that out in the community where we interviewed youth and parents and providers. And in that study, we really felt like youth who had effective advocates, whether it was a parent or a professional, were much better able to maximize their access to services. And so we have another study that we're trying to get funded. PCORI wouldn't fund it, to implement advocacy to teach youth and parents how to advocate for themselves through systems and through role modeling. And so I would say that providing advocacy either as a transition, probably as a transition, and to teach the youth and their family members how to navigate those systems will hopefully better level the playing field for youth who come from a variety of backgrounds, knowledge base, power, and abilities. That would be my biggest takeaway.
You had looked at immediate families and providers, but did you ever think about looking at or asking questions around where, outside of either friends or providers, where they receive support, no matter who it is?
Oh yeah, I think that's a really important issue, and in the study where we incorporate siblings and extended family, or whoever the family designates, and in the person-centered planning study, we did look at that to some extent. And some families draw a lot of support from professionals. You'll be happy to know that there are really great relationships, and we had some professionals come to person-centered planning meetings when we tested that intervention. But for the most part, it tended to be nuclear family and extended family.
And did I see you had a question?
Hi.
Just an observation. I noticed when I looked at the regulations that the education system, although it's the one system that's mandated to do transition planning, is not mandated to include health planning in that process.
Right, because the health system has its own process and they rarely speak to each other.
No, except the health system doesn't have a process in place.
Right, not a good one. Yeah, I mean, I think that the lack of coordination between health and education systems impedes the smooth transition to adulthood for families and kids who care about things across the spectrum of need. They're not solely focused on the issues that educators are interested in, nor are they solely focused on the health issues that the health system is interested in. So I think much better coordination could better serve young people.